Many patients come to us with issues that they need help to improve in. So just by seeing how their blood counts are, their blood pressure, in fact engaging them beyond what is physical, asking about their social background, their mentality, how they feel towards their life. I think if we can help them, it becomes quite impressive and satisfying. I think being in the committee helps me to guide how SingHealth Polyclinics develops our respiratory plans. We are not the best, but every now and then we make changes based on the recommendations internationally, and we try to implement things that will be helpful to our patients. Caring means looking beyond the patient's medical conditions and illnesses, thinking about how the patient feels, his ideas, his concerns, his expectations about life and his medical condition, and also looking at his family and his immediate situation, and eventually getting him back to a healthy state where he's fit and healthy to do whatever that he wants to do.
Actually, I was inspired by the nurse who taking care of my mother during the hospital stay, and also there's a nurse who actually is what we call a home care nurse, who actually come to my house to actually teach me how to do the wound dressing. So I was really inspired by their passions and dedications of the care given to my mother. Yeah, so when I thought of career switch, the first thing I come to mind is that maybe I can go into healthcare. I used to be one of the nurses who say wait, yeah. But after attending a course, actually the speaker just gave an example of how long do you take to change a diaper? Probably 5 minutes. But why you always need to say wait? Put yourself in their shoes. Do you want your poo-poo to stay on? You never. That's why I try to meet their basic needs, and they are quite settled down after that. Every time when patients recover discharge, give us a smiley face, say thank you to all of us. I think this is really, really rewarding.
Yeah, one of the most dedicated person who I've come across.
Thank you, Madam.
No, don't mention. I mean it.
After I graduated, I was really immersed into this as a house officer, and I really appreciated actually what does help someone means, and also doing it as a career, relying on things that I've learned and trying to apply it in real life, and seeing how that impact on my patients' progress and recovery. I think that sort of sold the deal lah. That was several years back. We had a patient who was really sick, who came in on a life support machine. We literally spent about 6 hours in that room trying to stabilize her, not just with the CGH ICU team, but also working with Heart Center, the doctors and their nurses. We managed to stabilize her. We managed to sort of transfer her late in the night. But the beauty about it was I realized that whoever who was with me in the beginning was still there at the end. So that was something that actually stuck with me for many years since. I guess the gold standard for me was that if I was that patient, how would I feel? And so whatever I do, I think I'll pack myself to that. And if I can deliver that, then I think I've done a good job.